the key to providing exceptional healthcare is having clinicians who actually understand their entire patient. So we want students to develop the ability to understand the whole patient, their personal circumstance, and their background. And more importantly, we want them to understand how the system can play an important role in shaping that circumstance. So ideally, through high quality education, our students learn that they have the power to actually help their patients and that they have the responsibility to change the system.
So over a decade, we found that health professionals who were able to navigate messy situations well were doing something called critically reflective practice. And this is the ability to question what's going on and find a better path for the person in front of you, for the unique situation. So we started looking at the best ways to teach. And this study really tested one of those ways of teaching. And it showed that it works. So we can help practitioners think more critically so they can be more collaborative, more compassionate, more innovative for their patients.
Critical pedagogy involves teaching students to question assumptions, to question their own knowledge, and to question the source of all knowledge. So we want them to actually not assume that the teacher knows everything, not assume that all of the teacher's answers are correct. It's about really pushing ourselves to be active learners and to think more critically about the world around us.
So you're trying to bring together divergent perspectives to come up with new ways of thinking, as opposed to having a discussion to come up with a consensus. So what we did is we had some learners experience pretty common teaching experiences. So they learned about social determinants of health, and then they discussed those reflectively. And then we had our innovative approach, which had learners in dialogue and asking critical questions. Questions like, who benefits from this? Who might be harmed? How could we reimagine this situation? And the learners who experienced critical pedagogy went into their future learning activity and actually talked differently. So they noticed different things. Rather than just the medical issue, they noticed the family situation, social issues. They challenged notions of what seemed best when, for example, a personal support worker might seem busy. The students thought about why that personal support worker might be busy and how the system could change. And so our findings showed that learners who experienced critical pedagogy were able to see situations more holistically, consider the social, and make more collaborative decisions to move forward.
One of the best things about doing research in a hospital, specifically doing education research in a hospital setting, is that you have an opportunity to get really close to the key questions at hand. So it brings us in close proximity to frontline teachers, to clinical problems, to patients. Certainly in other academic settings, you can conduct high quality research, but by being in a hospital setting, it allows us to be at that cutting edge and really understand the important challenges of healthcare today.
Our biggest obstacle that we overcame was coming up with a way to measure what matters, which is that critically reflective way of seeing, way of being, and not just measuring what's easy to measure, which in the past might be more like checkbox activities that people do.
One of the most important things when you're conducting high quality science is really recognizing the boundaries and limitations of what you can conclude from just one study. So certainly in this case, we have one exceptional study, but it is just one study. So there are some limitations to what we can assume is true from these findings. The nice thing is that we've been able to continue doing this work. And so we keep building and we keep asking new questions. And as we build more studies along the same lines, we get closer and closer to the answers.
I think the next steps for this work are to start to shift the dominant structures and the cultures within which we train and prepare and support health professions workers. This type of learning needs us to shift our value system and to think about the messiness of care and the long-term needs of care and not just the urgent or the technical.